first important concept which I want all of you to keep in mind is trisomy 21. Now, trisomy 21, short topic. It is going to come in the exam. The screening test versus the confirmatory test. Now, I ask all over India, whenever I ask any student that how do I perform the double marker test or the triple marker test or the quadruple marker test, we get the answer as amniocentesis and CVS. Amniocentesis, chorionic villus sampling. Wrong. Kachra dustbin. Kachra dustbin matlab wrong concept. Please understand, the screening test is done through maternal serum. Okay. What are the three important screening tests done through the maternal serum which we need to keep in mind is the double marker test or the dual marker test, the triple marker test, and the quadruple marker test. Please keep in mind that the screening test is done through maternal serum. The screening can also be done with the help of ultrasonography, and that is our famous the NT scan, nuchal translucency scan, and the confirmatory test which you need to keep in mind. Remember, students, in the whole world, the confirmatory test is only with the help of karyotyping. Karyotyping is confirmed because we have got 46 chromosome. We want to detect baby with 47 chromosomes. So karyotyping is the confirmatory test, and which can be done by either doing a chorionic villus sampling or amniocentesis. Amniocentesis and chorionic villus sampling are the techniques to get the sample, and once we get the sample with the help of either CVS or amnio, finally we are going to perform karyotyping. So please keep in mind that the screening test is with maternal serum, mainly an ultrasonography NT scan, and karyotyping is the confirmatory test. When do we do these tests? Okay, so please keep in mind the dual marker test is done in the end of the first trimester. First trimester T1 is what I'm writing. Remember, after 11 weeks, so 11 to 13 weeks is the time when I do the dual marker test. Very important MCQ. And triple marker test and quadruple marker test are done in the second trimester, 16 to 18 weeks of gestation. All these are important MCQ. Okay. Similarly, what is the time to do the NT scan is also done between 11 to 13 weeks of gestation. The NT value should be less than 3 millimeter. More than 3 millimeter is a marker for Down syndrome. And triple marker, quadruple marker tests are done in the second trimester. Now, when we come to the confirmatory testing, when do I do chorionic villus sampling and when do I do amniocentesis? So keep in mind, chorionic villus sampling is again done only after 10 completed weeks. So again, 11 to 13 weeks is the time when I do the chorionic villus sampling. And amniocentesis is done in the second trimester, roughly somewhere between 16 to 18 weeks of gestation. So this one very important table will help you solve lots of MCQs. You can get match the column also. Please keep in mind. And I will also write down just so that you have a complete crystal clear knowledge that which are the tests and when to do the test. So suppose if they give you an MCQ, which is the confirmatory test done in the first trimester? Chorionic villus sampling. So chorionic villus sampling is a confirmatory test. What is the screening test done in the first trimester? So dual marker test. S is for screening and NT scan are the screening test. Similarly, if they ask you, the triple marker test and quadruple marker test are done in the second trimester. They are the screening test, and the confirmatory test is the amniocentesis done in the second trimester between 16 to 18 weeks of gestation. So these are very important concepts. Please keep in mind. And of course, we are supposed to know the details of dual marker, which are the markers, triple marker, quadruple markers, all that we have discussed in our videos.